To the typical case study shit. So you have, I put 2 case studies up here from Nurse Jackie. Nurse Jackie season 1, episode 3, you had a task. Your task was to look at this whole entire episode, which I think is about a half an hour, and to pull out some management of care concepts, because what we're trying to get you guys to know this test plan and how it is really going to look in a question on Nclex. So let me explain that. As you know, there's a million parts of the test plan for NG and Nclex. The first one is, and it's on your CPR report. And I always try to go in order. Sometimes I remember the order, sometimes I don't, but I try to go a little bit in order. So the first thing, if you're LPN, on your CPR report was that coordination of care. Well, if you're RN, it's management of care. It's the same shit, different day. That's what we're focused on right now. So management of care. Then the next one I think is infectious disease. The next one after that is health promotion and maintenance. And then after that, I think is psych or something stupid. And then basic care and comfort. Then you have your pharmacology. You got reduction of risk. You got physiological adaptation. You have all of those. So those should make sense to you. Obviously, they're in the Oh My God packet. What page are they on in the Oh My God packet? Those concepts. Management care. Test plan, I guess you could call it.
7.
Okay, no. 14. Don't guess. Make sure you know. Don't just be shouting out garbage. 6. 6. No, definitely not 6.
It's on 14.
It's on
14. She said 22. Sound like we need to have a fight about it. So whoever said 22 is close. Where is the NGN test plan, which is what the fuck I asked y'all. Wow. If you listen to the question, maybe you'll get the right answer. So it's something about that whole question that had y'all all confused just now, which is proof that you really have to watch the question. The question I asked you was, where is the NGN test plan? You gave me 14, 22, 30, 39, 49, 700, 3,000. Okay, now, meanwhile, back at the ranch, it is on page 23. Now, this entire test plan is on page 23. My challenge to you was to give me management of care concepts from watching this. Now you can tell me where the management of care concepts might be in this packet. There's more than one page. What do you think they are? And remember, everybody, we're in Oh My God package, just in case y'all on some trash. So what management of care topics am I speaking of when you think of what you watched in Nurse Jackie? What page would it be on?
14.
You think 14? Let me see if y'all right. Yes, excellent. Very nice. Okay, so let's go. Tell me what you saw. I'm filling it in. What were some management of care concepts? Shout it out. Don't waste my time.
Professionalism.
Professionalism's a good one. What are some more? There was a million. So y'all better hurry up. Y'all wasting y'all time and your money. Give me more. What is it? No, didn't see that in this episode. You got to remember, it relates to the episode. The whole point of this exercise is so you can apply the knowledge I gave you. So what are the concepts that you see in Nurse Jackie? One at a time, since y'all fucking up. Give me a concept.
I didn't see it.
You didn't see Nurse Jackie? Go to your car and watch it. I need a concept, Miss. It's not optional. This fucking class. Okay, what's my baby? Give me a concept.
Oh, I wasn't done with the test, so I didn't get
Go to your car and watch it. Give me a concept. Do you think that's a management of care concept? You said page 14, right, y'all? Y'all better learn. I'm serious about these case studies.
Impaired nursing.
Thank you. Impaired gonna be salty as fuck. Y'all got to do what I tell you, because the whole point is trying to get your fucking license. That's what you paid me for real. Next.
Promotion, no, comfort.
Come again? I can't even hear you.
Comfort care.
Is that a management of care topic on page 14? Next. Palliative care. Excellent. Don't be mad at her. She took your answer. There's about 17,000 more. That's how many concepts were there. Anybody else? Come on.
Workplace conflict.
Patient
Hey, who said that?
Who, me?
You. You. Patient advocacy. Excellent. Remember, you're focused on page 14 and you're trying to think, what did you see in Nurse Jackie? If you didn't see Nurse Jackie, take your ass to your car and watch it. Get out my class right now.
Informed consent.
Come back quick. Watch it like about 15 minutes, because you ain't got to go watch that much. It's in the beginning.
Informed consent.
Informed consent. She not gonna give me all of these. Need another nurse. Yes. What the fuck? Advanced directive should have been out your mouth first. If that wasn't advanced directives, nothing was. What else? You already gave me one. I need people who have it.
Self-determination act.
What you got?
Who, me?
Yeah.
Malfunction.
Non-malfunction?
Non-milk.
Non-maleficence?
Yeah.
Explain. What example? If you got an example, I'm good with you. But you gotta have an example. If you don't, keep looking in there. I swear to God, there's a ton of stuff in this episode for management of care.
Well, self-determination act. Right?
Yes!
I was about to put
You get a gold star for that. Damn, she told the club up with that. Self-determination act. Don't be hating on her because she knew her shit.
I don't got.
And don't be trying to beat her up in the bathroom. All right, what you got, little mama over here? I mean, it's only 3 letters. Go ahead.
Did you say advocacy?
They're already up here. I can't believe you're missing the 1 word, 2 words. They're so easy. One is only 3 letters long. You did it already. I'm waiting on 2 more people to holler back at me. Tamika, what you got? We don't do that in this class. Are you on page 14? Or in your phone? My baby's so cute. She said, well, I'm going to be honest. I'm on the phone. Well, go look at page 14. What you got? Veracity is good. Veracity is good. I'm going to put it down because I saw a little bit of that. Veracity. We're going to see what y'all think these mean in a minute. Give me your examples and whatnot. Okay, I got 2 and you're going to be mad when I give them to you unless you want a little bit more time. One is only 3 letters long. Not AMA. Nobody left AMA. I didn't see none of that.
Right to refuse.
Okay, that was already up here.
Alternatives.
DNR.
Because it's
Thank you. DNR. Very good. That's the 3-letter one. And then the other one, you're on the right track, but you're giving me the wrong word.
Oh, I was going by
One more, y'all. It's the most important one of the whole bunch.
Autonomy.
Yes! There go Miss Winston back there. She here, y'all. She here. Don't fuck with her. Okay, now let's look at what we got for real. Because y'all got to like fucking know this, okay? Now, so management of care are the terms on page 14. Applying them in a way that makes you remember them forever for a test means looking at something you actually enjoy and seeing how this played out in this case study, right? So let's go through the case study. Mr. Z had fluid in his lungs. He was short of breath. His history includes CHF with a history of quintuplet. Oh my God, bypass graft. Quintuplet is that 3, 4, 5, 6? What is that? 5. 5 arteries were blocked. They opened them. That's what that means. Around 1994, to put it in perspective, Nurse Jackie was created around 2010. So if we go by that, it's more than 15 years. He has a history of coronary artery disease. Per the doctor, she described it like this. The arteries were closing up again, and decreased blood flow is going to the heart, causing fluid to build up. At the very least, he needs an angioplasty. At the most, he needs a cabbage, which is another bypass graft. Patient states no angioplasty, no bypass, no. He's worried about his wife. Jackie does some therapeutic communication technique, which, by the way, is a management of care issue and a psych issue. The patient's previous doctor gave him no greater or no more than 6 months to live. She told acolytus, they were waiting on test results. Now, you guys gave me the best. I mean, you did fair. You gave me professionalism. Who gave me that? What example do you have?
When she was,
Nurse Jackie
was intermingling with the pharmacist guy.
Oh, well, she fucking a pharmacist. She ain't professional. Okay. But one breach of professionalism, and Nurse Jackie's a lot like me minus the drugs and fucking pharmacists.
Right.
But one of the things that she did that is exactly like me, if you really paid attention to her, when she talked to the lady on the opioids, look at what she said. Look at what she said. Look at what she said. I'm gonna keep on going till somebody looking, because y'all talking ain't learning. Okay, so look at what she said. She said, if you bullshit me. Now, some would call that unprofessional. I would call that real nursing.
Me too. I thought that was getting to the point. That's why I think that.
If you don't want to get in trouble because your boss is on bullshit herself and might write you up for swearing, then you can say, don't BS me. But what patients appreciate more than anything in the world is regular fucking people. Okay? Remember that, y'all. That's a big deal. So this was therapeutic communication. Some would call it unprofessional. I wouldn't. Okay? Now, you said impaired nursing. We all know who that is. Palliative care is exactly what they were doing, but what would have been better since the doctor said no more than 6 months? Hospice. He should have been referred to hospice back then, because what is hospice? It is based on a 6-month life expectancy. Now you got to know this for the test, y'all, for real. The care for hospice and the care for palliative care is exactly the same. The difference is 6 months life expectancy. That's hospice. Once you see that on your exam, you say, that's hospice. They're gonna have it, I promise you. Okay, so that would have been a good hospice patient, okay? All right, now you guys gave me more. You gave me patient advocacy. Give me an example of it. Whoever wants to give it to me, whoever gave it to me this term. What was the example?
Try to put the patient was dying, and I feel like they try to like brush it off, push him out the room and stuff. So
Administrator tried to push him out the room with her little evil self. And so you saw Nurse Jackie advocating for her patient. Like, have you ever been a nurse? If you have, can you send the nurse in there then and look at the patient? Like, actually look at what's going on in here. All right, fine. The patient's dying. they can stay for your shift. Wow. Now that's real. That kind of shit, that's your charge nurse shit. They trying to get people out of the unit. I get it. You gotta need more beds. But you saw Nurse Jackie advocating for her patient. Okay, that's a management of care term. What about informed consent? Somebody gave it to me. I don't know who. What's your example?
When they were treating the homeless guy. Did I watch the wrong episode?
But it's okay, girl. Now, informed consent was in this one too, but it was informal. So what was it? It was this. No. That's informed consent. Because the doctor told him what was going on, and then the nurse followed up reinforcing, and he's like, no. He's had informal consent, informed consent. It's informal because only a doctor can get a written one, and only the doctor can explain what would happen if you don't, but he already knows what's going to happen, and technically so does his wife. Okay? All right, so this was excellent. Advanced directives. He either had them or he didn't, but if you'll notice at the end, clearly he must have, because what did they do? No code, right? They let him die. You heard her say, nope, we don't need nothing. So that was an advanced directive. It's just unclear, like, was it in writing? Because Nurse Jackie be on some shit sometime. You do need an order, okay, guys? You can't like cowboy and cowgirl it out. You kind of need an order from put in the chart. It'll say full code or do not resuscitate. I've seen it say DNI. What does that mean? Do not intubate. I've seen it say DNRCC. What does that mean? Comfort care. Okay, so just know these are designations that go in the chart. All right, advanced directives. If I were to define advanced directives, I want you guys to remember it like this. It is a written list of wants or desires. In the case, you can't verbally tell me. It's just a written list, y'all. Don't get crazy with it. Sometimes I think advanced directives are like confusing to students. No, it's an umbrella term. It's a broad term. There's a lot of shit that goes underneath it, including whether or not you want to donate your organs, whether or not you want a DNR or full code, whether or not you want to designate someone as your medical, what do they call it? Healthcare proxy. Remember that on the test, because those words, if you're like me, you're like, what the fuck does that mean? Healthcare proxy is your medical power of attorney. I got to get y'all to know the two terms. Those were on the test repeatedly last week. Okay? So again, healthcare proxy, medical power of attorney is an example of something that goes under the umbrella term of advanced directives. The best one up here is Self-Determination Act. You have a right by law, that's what this is. When they say act, it means it was passed by law on a federal basis. You have the right to determine how you want this to go. So that's what he was exercising. Then you guys gave me, I'm not sure about this veracity. Who gave me veracity? And tell me what did you think about veracity, baby?
I think I got confused with like the nurse was doing with the administrator. I had confused when she was like,
Okay, so you're thinking, did she violate the principle or did she keep the principle? What did she do?
she bended it a little bit because she could have said, you know.
But that was with an administrator, right?
Right, yeah.
I'm seeing where you're going, but I would think of veracity more so with patients.
Okay.
We talk shit with coworkers all day.
Right.
It's on your test, it will be directed at a patient. Now, that's like telling the patient, maybe this one. Let's do one of veracity. Vicodin's okay to use. You just, should use birth control. But Vicodin is okay to use And that would be a total fucking lie, right? So that would be a violation of the ethical principle of veracity. That's how they're going to word this, you guys. Point out what principle has been either violated, what ethical principle has been violated, or fill in the blank. This nurse violated the ethical principle of boom, fill in the blank. They got fill in the blanks. Okay, now, DNR and autonomy, y'all know what that is. We already did that. Autonomy is, again, same shit as this. You have the right to decide what's good for you. And what's good for you may not be what I think, but it don't matter what I think. It's based on what you think. Does that make sense? Y'all handled that. Okay. Now, so we have a challenge for you. I already read this one. Now I need to know if you look, raise your hand if you need a management of care packet. Y'all should have one by now. Only one person, maybe two babies. Okay, I'm gonna go get so if we look in our management of care packet and we go to our therapeutic communication, I need you guys to find which one of those techniques did she use. And it's deep into the packet, you guys. Way deep into the packet. Let me show you what page we're trying to get you on. Hold on, baby. Hopefully it's in here. Look. Okay. It's going to look like this. Therapeutic communication. Therapeutic communication. Okay. All right. Therapeutic communication. She used one of those on the list when she was talking to this couple, specifically to the patient who said, no, 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 no. I don't want none of that shit. Don't do nothing for me, blah, blah, blah. So I want to see if you guys can find it on that page. And again, it's in your management of care. It's on the therapeutic. You need one of these, hon, or you got one? You got one. Yeah, you do. If you came, did you come to the boot camp? Oh, you didn't? You never? Okay, here. This one you need. Come get this one, baby. Yes. Okay, did you get one, hon? I think you got one because you came to boot camp. But that's it. That's the one. Look for the one that says therapeutic communication. Which one, y'all? Anybody find it? Yeah. Yeah? Who said that? What do you think it is?
Active listening.
She did use that, but that isn't what goes here. No. No. She literally said, okay, in all seriousness, clarifying. What does it say for clarifying?
To check whether their understanding is accurate or to better understand the nursing statement an unclear or ambiguous message to clarify.
Yeah, because they're telling her they'd rather eat soup. And they told the patient, your ass need an angioplasty and another bypass. But to hear them tell it, you telling me you want to eat soup instead. So what did nurse say? I mean, you saw her do that. You said, now wait a minute. In all seriousness, I want to be clear here. You're telling me that you don't want anything, and you know the consult with the doctor, and the doctor's really good, and blah, 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 blah. That is major on your test. Those list of therapeutic communications. Whoever was, I flipped this board over today, and whoever was in our class last, I think it was Jasmine. She had this. She had therapeutic communication on her test. Okay, so just make sure you know this stuff we going over is so that you're ready. You are like, bring it on. Anything you bring, I got. Okay? All right, so that's it. Now, hard part. Let's see what you do with it. They told Acolytus they're waiting on test results. Every single one of you are going to tell me what kind of test results would you think would be ordered for this guy. We'll start over here first. What you got, baby? What kind of test results might we run on this patient? I'm going to fill in every blank that makes sense. If I don't write it, it don't make sense because you're going to take a picture of this. I love it. Probably one of the first things we're gonna do is a chest exercise. She's like, thank you, Jesus, I got one. Got it out the way. Fuck Shelly. Shelly on some trash, fuck her. I got mine out the way. Chest x-ray, very nice. Okay, baby girl, Tamika, got anything you want me to order on this guy? Yes, I like that. An echo. Now, what do you think we're going to get, everyone, when we do this echo? Why did we do it? What little finding do we need for CHF?
Ejection fraction.
Ejection fraction. Go on, girl. Get it. Now, watch this, guys. This is called EF on your test. They'll spell it out, but you got to remember what it is. Remember, you got to take everything apart on this test. In other words, whatever vocabulary you're looking at, separate the words and think, what could it possibly mean? An echo is an ultrasound of the heart. Don't forget that shit. And when they're doing this ultrasound of the heart, they're looking for the ejection fraction. And all I got to do is take you back, way back in the day when the eject button meant something. I know you young, but we got to go way back. Okay. I'm almost positive nobody in this class is as old as me and can remember 8-track tapes unless you had an uncle. Anybody remember what those were? Oh, thank God, I got my Charmaine. So Charmaine, you remember that big ass cartridge that used to sit in the freaking,
And then that little thing was going.
and then you press what? Eject, and what happened, everyone? It popped out. Okay, I left all of y'all. I'm coming to get you now. Let's go to the next step. A few of you can hang with me on this one. Who remembers cassette tapes? That's how I learned all the words to Adore by Prince. Cassette tapes, rewind, replay, rewind, replay, rewind.
Right.
Over and over again until I got all them fucking words. Now I know all them words, okay? Till today. Now, what happened when you press eject?
Right. The thing.
The cartridge what? Popped out. Okay, fine. I'm coming to get the other half of the class. I know you young. I get it. Shit, fuck all y'all. Here we go. Remember DVDs. Did I pick up some more people? Hey, we getting there. DVDs. Back in the day, you had the DVD or the CD. In my car, because I'm old as fuck, when I bought it, I said, I don't want anything that doesn't have a CD player because I got a lot of classic CDs. They looked at me cross-eyed and then some and said, oh, okay, we'll try to find that because y'all don't even have that shit no more. But when you did, and in my car right now, if you press eject, what the hell gonna pop out? That CD or that DVD. So all of those I say because that's what the hell you gotta remember on this test. Ejection means to pop out. What's popping out of the heart? What's coming out? Blood flow. The ejection fraction is the fraction of blood that pops out with every contraction. Now, it should be 75% and higher for us little babies in the class because you're young and cute. But when you're less than 50, it's CHF. And it goes down and down and down. And if you remember Grey's Anatomy, it went way down on Brother Man before he died. Okay? So, ejection fraction, these two, y'all need to really pat yourself on the back because you kind of fucked up here, but you're redeeming your little asses right up in here. Okay? Okay. Now, give me some more love. What else you got?
That was the case with his mom on time too.
What the hell are you talking about? Give me a lab, girl. What lab are they going to draw on this patient? Yeah, it's on you because you talked. Which one, baby?
A CT scan.
Oh, you want a CT scan? Do y'all think we need a CT scan on this patient? Hell no. Give me some labs.
The thrombo.
She can't even say it. What the hell? Uh-oh. He said CBC. What did you say?
Troponins. I'm sorry.
Troponins.
That's what I'm trying to say.
Now we're talking. Troponins. Somebody else says CBC. Do y'all want both of these tests or not? Somebody said a CMP. I asked you about these two tests right here. Do you want these two or not?
Yeah.
Okay.
Yeah.
Now somebody says it's CMP. Tell everybody what a CMP is, whoever the hell said it. Comprehensive metabolic panel. Do we want this? Yes or no, ugly people? I want it. I don't know about your ass, but I'm interested in the potassium. Okay? Okay? All right. What else we want? And the sodium. We got a fluid overload. We're looking at sodium.
Right
The hell? What do you want here? She said, can we do a MRI? A $6,000 test you want to do on this guy dying? Really? Help me understand that.
What about EKG?
Okay, I'll take an EKG. We'll deal with that. We'll deal with an EKG. The little man is short of breath. He didn't have bypass surgery. We can do with that. That's some respect on her name. You got 3 more? BMP. I've been waiting on you all my life, girl. Go with your bad self. Here we go. Now look, put a star by that one. You got the #1 test we should have ordered for this guy. Now they waited 10 years to order the shit, but you came up on the rear, so it's all good. What is a BMP, people?
It's the beauty
B-type natriuretic peptide. It is the CHF lab. Hello? Jesus, help me. What else you want, damn it? I ain't heard it yet, but you got time. Who said it? We are not stressing this 900-year-old man. The fuck?
The contrast?
No, baby. That goes with the CAT scan. What we doing, y'all? You're going to be mad if I put it in here.
Wait a minute.
Oh, wait a minute. Wait a minute. Wait a minute. Look at the whole scenario, especially the first thing. That's a lab now, huh? Who said that? Fuck yeah. Don't hate her. Don't jump on the bathroom. Don't wait on her at the sidewalk in the playground. What else? Y'all want something else? Know anything else? What is it, baby? That's a lab now?
No.
Let me just
You will look at that.
test fucking results, okay? That's what we're dealing with right now. People.
Okay. All right.
Any more? Oh shit, my dude. Hey baby, how you doing? Hold on, honey. He done been in class some damn where. Okay, y'all, come on. What'd you come up with? Anything at all. You're gonna be mad at me.
She say what I just.
Would the management of care can be at hospice?
We did. You were gone. Okay, y'all didn't do bad on that. I ain't even